Assalamu alaikum. This is Shama Tazara, and today we're going to discuss another important disease of gynecology, that is trichomoniasis. Now, as the name suggests, what will be the causative agent of this disease? Of course, Trichomonas vaginalis is the causative organism of this disease. Fine. It is basically a protozoa, and it has some important properties that help in its transmission of the disease to other individuals, like of course humans. So first of all, it is a motile organism. Why? Because it is having a 4 unipolar flagellas that help in its motion. Secondly, it can survive for many hours in the moist secretions. So what does this implies to us? That as it is motile, so its mode of transmission will be sexually transmitted. Why? Because of course during the sex, if it is spent in the genital tract, then during intercourse it can spread to your partner with whom you're performing the sex. Fine. Second is its non-sexual transmission. Now, talking about non-sexually transmitted form, why it occurs is because it can survive for many hours in moist secretions. So, from mineral water in the bathtubs or from any other moist secretions, it can spread to other individuals, which is of course non-sexually transmitted. Third is vertical transmission. Now, to remember what is vertical transmission is that mother give birth to a child, so it's a vertical transmission. What it means is that the transmission of an organism or a disease from mother to child during the delivery, this is called vertical transmission. So these are the three modes of transmission of this protozoa. Moving on to what are the predisposing factors. Now, predisposing factors are that, of course, since it's associated with sexual transmission, so of course the young females who are sexually active, they are predisposed to this disease. Then after it grows well in alkaline medium, very well in alkaline medium. So females immediately after their menstruation, they are more susceptible to the disease, because at that time the pH of the genital tract become alkaline. Then women in their 40s of age, like 40s means 30 to 40 years of age and so on, they are also predisposed to it. Plus those women who are using non-hormonal or non-barrier based methods of contraception, they are exposed to this disease more commonly. Then, talking about the risk factors, now the same whole theme that we discussed before. What will be the risk factors of the disease? Of course, if a person is having a multiple sexual partners, whether she's a girl, whether she's a male, then it can transmit the disease to other, and of course he or she can get the disease from many individuals, so he is more at a risk for developing trichomoniasis. Secondly, if he is having a previous history of trichomoniasis infection, then reinfection can occur, or previous any other sexually transmitted infection history. Or if he or she is undergoing unprotected sex, means if he's a male, he is not using condoms before starting the sexual intercourse, then they can be the cause of trichomoniasis. So these are the risk factors. Moving on, that how will the patient presents to us, what will be the clinical features, its symptoms and its signs, particularly the female. Talking about the female, how will she present and what will be the clinical features? First important point is that, of course, vaginal discharge will be present. Now, as we've discussed before in my video of candidial vaginitis, what happens in it, that's the same thing, vaginal discharge is present. But how to differentiate the two diseases? In it, the discharge is thick, white, I repeat, white, curdy discharge, or cottage cheese like discharge, and there was no point that it's a foul smelling discharge, so it is not a foul smelling discharge. But talking about the trichomoniasis, here the discharge is yellowish green color or brown in color, or very important point, it's a foul smelling mucopurulent discharge, plus they will be frothy. Now what does this frothy means? Look at this diagram. If suppose this is that diagram of a patient whose vaginal examination we have done, then what will happen here is that there is this yellowish green discharge here, Fine, this is that yellowish green discharge. Plus I've tried to make some bubbles here, so these show that it is a frothy discharge and froth is present there. So this is how you differentiate this disease. Moving on to the speculum this was all about the vaginal discharge. Then of course, since infection is occurring within the urethra, in areas downward where there is vagina and urethra, so there will be painful urination, dysuria, painful sexual intercourse, dyspareunia, plus of course there will be some itching present there. So this itching is called the pruritus vulvae. Itching will be seen there. Moving on, that speculum examination. Now when we put a speculum into the vagina, same speculum, same type of thing as you remember in ENT, we do ear examination by ear speculum and nasal examination by nasal speculum. Similarly, there is a speculum used for visualizing the vagina and the whole vaginal canal up to the cervix. So yeah, this speculum examination, it will show us that, very important, they will be punctate as if some punctures have done there or injections have done there, as if appearance there. Redness, erythematous means, and papilliform appearance, like as if papillas are present on the surface. So the surface will appear as punctate, erythematous, papilliform appearance of the vagina and the cervix. Now how will this looks like? Just look at this diagram. Like this is the strawberry appearance, and we call this appearance the strawberry appearance. Now I've just drawn it here just to visualize it. Let's suppose this is the whole vagina which is seen through the speculum. Then this, like these red patches, you can see red patches, erythematous, punctate lesions appearing like a strawberry appearance. So this is characteristic of the female when we go for its speculum examination. Plus she will have a frequent urgency to urinate, like she feels that I have to urinate, I want to urinate frequently, more than normal. These were all the signs and symptoms which will be seen in a female. As we know that males can also have this disease, so in males they will be, like in females there is vaginal discharge, in males there will be urethral discharge. One point. Second, of course, we will having painful sensation, dysuria and dyspareunia, so they will also have burning sensation or painful sensation while urination or during ejaculation, plus frequent urgency to urinate. So these are the points by which the patient will present to you. Now moving on, that important point which we consider here, that what are the diagnosis measures, how we will diagnose this patient. For that I made a mnemonic, that there was a gnat which I put it in my pocket, and as a result a smear became produced on my pocket, and to remove it I use a swab to remove it, and then I examined it that okay, what was that basically a smear made of. So this is the basic mnemonic for it. Now the gnat which is present first, since it's causing the main thing of this whole mnemonic, so gnat is the gold standard investigation for this disease. Fine. What is gnat? Now first disease is gnat, nucleic acid amplification test. Fine. What is this test? It is a gold standard test. Okay, what we do is that we take a cervical swab or a vaginal swab or urine sample to perform this test. Fine. And but mostly it shows the Trichomonas vaginalis, that organism is seen in its DNA or its genetic material is seen, which gives identification. But sometimes what we see is that we see Neisseria gonorrhea or Chlamydia trachomatis in the results. Then what we do for an optimal test for this case, we go for vulvovaginal swab, and it of course gives us the exact diagnosis. Moving on to a second investigation, that is the pocket. Now how to remember this pocket? First of all, it's a rapid test, and what it is, point of caring test means. Now you're thinking that what will be this thing, and it's very complicated type. It's very simple, that as we take the samples and take it, send it to the laboratory, and then for investigations, what is this method, that we don't send it to laboratory. These are all those investigations which are done on the bedside of that patient, and immediate results are seen. Like we have urine test strips, we use it for immediate results. We don't need to go to the laboratory for those investigations, right? This is basically rapid point of caring test. Then a smear was produced as a result, and from this smear we have two investigations, pap smear and wet smear. Now pap smear is done, and most common results are seen on the cervical swabs. this. And wet smear, now what is wet smear? We take the discharge through a swab, of course, from the female vagina. We mix it with normal saline, put it on a slide, and then see it under the microscope. Now what we will see is flagellas of the organism will be visible on the microscope. We'll see. Moving on, then we took a swab to examine it. Then we took a swab in the mnemonic. And what is that swab? It's a high vaginal swab. Of course, vagina is involved, so we go for high vaginal swab. Now, what it is some different in this swab is that we take the swab and put it in a special medium, which is Feinberg-Whittington medium, right? So it's important here. It can be in your MCQs, or someone can ask you in your Viva. And lastly, we go for examination. Now there is a very important technique here which is called the colposcopic examination. Now what is this colposcopic examination? It will come across again and again in many diseases while studying gynecology. So colposcopic examination is that what we do, suppose this is that female, its pelvic part, this is its uterus, and this is its vagina, and this is its cervix. So by this technique, what we do, we put a speculum in the through the vagina into the vaginal canal up to cervix, and this is a microscope placed here which throws light into it, and this is an illuminated procedure, and under the microscope we see detailed examination of cervix, vagina, and the vulva. So we easily identify any abnormal features because there are some characteristic findings for each characteristic disease, so we exactly identify it. So I hope now you have understood what is colposcopic examination, that we see the vulva, vagina, and cervix by the speculum, illuminated procedures seen under microscope. Fine. Now what we do here is that what will be our findings? We see that there will be double loop now, as we know that already vagina is having punctations, the puncture type appearances. So here on the vagina and cervix we see double loop, coarse means thick, punctations on the vagina and cervix. And now they can be either diffusely spread and extensive on the vagina if disease is of course advanced, but they can be localized as a patch. Like suppose this is the whole vagina seen, and there will be this kind of a patch which is of course red and pinkish in color, so that is localized. And diffuse is it's equally spreaded on the whole vagina. Moving on, that this is how we'll diagnose the patient. Then we go for treatment. Now how will someone just randomly asks you that what is the drug of choice for trichomoniasis, and you're just puzzled that I don't know what was the drug, whether it was fluconazole or itraconazole or I don't know, I just studied and I forgot. So just to remove this whole confusion, I have just made a mnemonic. Now, what is the disease name? Trichomoniasis. Tricho is of course from the organism Trichomonas vaginalis. So just remove this tricho. The second part is moniasis. It starts from the word M. So if you remember this word M, then you can easily remember the disease, the drug name, which is the drug of choice, metronidazole. And since I have divided into two parts, so 2 gram is its dose. Just to remember. So metronidazole is the drug of choice, and the dose is 2 gram dose orally, and it is given as a single dose. Fine. So starting with the treatment, I have already discussed that it's metronidazole, which is the drug of choice. 2 gram dose is given orally, and it's a single dose. Now we know that the disease is transmitting sexually, so we give the drug to of course the symptomatic female, plus we also ask her to give the same drug to your male partner, your sexual partner, of course your husband or whatsoever. So this drug is given to both of them. Now it's just a single dose, but some patients or some doctors they repeat it after 24 to 48 hours also. It's optional. Now precautions for this drug, as it's a drug of choice, so we should know its side effects and precautions. So first of all, we ask the patients not to drink alcohol strictly. Why? To avoid disulfiram like reaction. This. Secondly, in the first trimester of pregnancy, we ask the female, we just say that metronidazole should not be given in first trimester pregnancy. Why? Because there is a metallic taste, its side effect, and nausea, so we avoid these two features. Moving on, that of course there should be an alternative therapy, because not all the patients can take metronidazole. So its alternative drug is tinidazole, and it is of course 2 gram dose, and a single dose is given. to the pregnant ladies, now we have already discussed that we can't give metronidazole to the female. Now a question arises that what we should give. We give clotrimazole, as we've discussed before that clotrimazole is given in Candida vaginitis also. So clotrimazole in the pessaries form is given to the female. Moving on, that as we know that recurrent infections can occur in this disease. So for recurrent infection, what we do is that we ask the female to take, of course, metronidazole. But either metronidazole is given orally or in IV form. If you're given it orally, then we give metronidazole for 7 days, BD 400 mg. But if we're giving it at IV, we want rapid results, then in that case IV metronidazole is given for 6 consecutive days. You can't give a break in between. Now, this was all about the treatment. Moving on to complications. Now, of course, if you don't treat the disease, then it will lead to complications in the patient. First of all, untreated, the patient becomes a carrier and it transmits the disease to other individuals. 1 point. Secondly is that the vaginal mucosa, once it is exposed by this disease, then it becomes more, we can say, prone, or there is increased risk that that vagina or that female can contract other STIs like HIV and AIDS, and it is very severe. So it should be treated timely. Moving on, that if you don't treat the patient timely and the patient is left untreated, then the disease can spread up. Up means pelvic inflammatory disease. It will move up to the whole pelvis and an inflammatory disease will occur. Now, why I'm talking it in complications, that if PID has occurred, then it can lead to very severe complications. Like if it moves up, then because of scarring, fallopian tube can become blocked, and once they are blocked, then of course ovum can't enter the whole uterus. So patient will become infertile, no pregnancy will develop after it, and of course some abnormalities occurring, inflammation, so patient will have pelvic and abdominal chronic pain. Fine. Now, what happens if the patient is pregnant and she has developed trichomoniasis? Then there are some complications. That first of all, during the childbirth, she will transmit the disease to her child, the newborn. Secondly, the newborn born will be either premature delivered, or if born normally, then there will be low birth weight babies born, or the child born will have intellectual abnormalities. This was all about trichomoniasis. I just summarized it so you can easily remember it and recall it. So thank you very much. I hope you liked the video. If you do so, please like, share and subscribe. And it's a request, please share it with maximum medical fellows you know, so that you can be a part of this chain of helping others. Thank you so much. Allah Hafiz.